Hello everyone, and welcome to another 3-minute therapy session with me, Allie Bailey. And today we're going to be going over something that I wonder if a lot of you have heard of before. If you haven't heard of it, or if you've heard of it, pop over here in the comments section because we love to connect with those who are listening and watching our content. So this therapy method that I really think is unique is going to be called person-centered therapy. So here I am sitting in center of the camera, but what does that mean? What does the therapist do during this method? Well, the therapist accepts the client unconditionally, which we never judge as a therapist. We always come into our session without bias. We come in non-judgmentally, but we come in with unconditional positive regard, which means that regardless of flaws, regardless of past experiences, the genuineness of the therapist comes across a little bit differently. The therapist, does their very, very best to see the world through the client's eyes and is very authentic and able to share their own thoughts and experiences that are appropriate, of course, and not overstepping what the client needs. The therapist in this situation allows the client to lead the conversation and doesn't really give a lot of interpretation or in essence provide direct advice. So when it comes to exploring the issue or presenting problem, as we call it here in the clinical world, the client is the one who takes the lead because, we're all equal. Therapist, client, prospective client, no matter who we are, we're all equal. Therefore, the client is able to take the lead and explore, what their current problem is. However, the therapist can encourage the client to, explore more of themselves and discover their own insights. So just kind of teaching a little bit more about different therapy styles that are out there. An eclectic therapist, which means, we know all of these different theories and methods. However, one size might not always fit all. So we might use cognitive behavioral therapy paired with dialectical behavioral therapy, but maybe our client needs a little bit of assistance in the person-centered therapy approaches. We have many different therapy methods out there as therapists, and we're here for you, and whatever you need, we can definitely help you. So I hope you guys like this little overview of person-centered therapy. If you've ever heard of Carl Rogers, that's who made this theory, and it gets me so excited because I love theories and I love learning about it and also educating others. Let me know what you guys thought. See you on the next one.